So next thing this poor individual needs is an occlusion on their upper right first molar. And again, not for human use, demo only, but exactly the same idea, and the form of the tooth is exactly the same. So let's take it out of its packet. These come sterile wrapped, by the way. And there we see the appropriate tooth. And again, beautiful, beautiful morphology. Already size selected, fits on the tooth. So the next stage is precisely like we did with the other one. On this one you don't need to, but if you want to knife edge the margins, it's a good idea. If you don't want to, then don't. Each individual case is different. So just like with the veneers, feather edging the margins. And breaking the shine on the fit surface. For speed, again, I would usually use the Etch Master or my Crystal Air. It's my preferred technique. Remove the dust, and exactly like before, the veneer bond onto the surface to give it a nice chemical bond to your composite. This is not for use on teeth. This is solely for use on the veneer. It will not work on organic tissue. As always, thin. Blow away the excess carrying agent and 10 seconds cure. Other lights take different times. Now, because the concavities on the fit surface are quite deep, what I prefer to do, which I do anyway, is always put a thin layer of flowable before I place composite onto anything. Just chemically wets it down. So the enamel nano hybrid flowable composite, I'm just using this as a smear layer. This is the edelweiss one. What I will do is just a very thin amount, filling the concavities and just getting a smear layer across the entire inner surface. I'm actually expecting the vast majority of that to actually squidge out of the sides. I want it to be displaced by the thicker nano hybrid. I'm going to use A3.5 for this because I want to show you some colour changes. So again, this is a very thick composite. When you use it for normal restorative treatment, this composite is beautiful because the feedback when you adjust it is very much the same as enamel. You can really feel what you're doing, which isn't always the case with composite. And I do routinely use this now for my general restorative work. And unlike some brands of composite, this is spot on from the Vita Shade Guide. If you watch, you can hopefully see the majority of the flowable coming out. This just is avoiding air voids. Just if, with the best will in the world, if you're in a little bit of a rush, you get distracted, you might just trap an air bubble underneath. So same technique as before. Approaching from the back of the mouth this time, but you know, you can always approach from the front of the mouth, but for this, and again, pressing it into place. You can even get the patient to close down. And of course, this person had a 3.5 posterior shade, because I did check it first. But to just gently close into occlusion to get a bit of function going is a nice little head start. Obviously, you don't want people to chomp and bite super hard. That's very silly indeed. And patients do tend to do that always, as we know. I always try and avoid the word bite. I say touch or tap. But people still have a lovely habit of surprising you. So just getting it conforming. And I'm very happy if there's a bit of a void just to run a bead of flowable into there to avoid any little black lines where there's a discrepancy or a bit of lacking in the bond. And if there's a gap, it's no good. I'm just going to tack it into place and come around the inside. Very happy to run a bit of flowable. It just helps the instrument glide more easily. And again, you're taking the vast majority away. The intention is not to leave a layer of flowable, it's just really belt and braces. And again, one would use cellulose or whatever sort of preferred matrix between. You can floss, you can do whatever you would normally do. But for the sake of this, I'm not using it because plaster models are a nuisance. And again, tack around the edges. From on top. Being a nice translucent material, the light does transfer through it very nicely indeed. Obviously, if it was an opaque material, this wouldn't work. And manoeuvring the patient to suit my torch rather than vice versa. Wouldn't it be nice if it was this easy always with real people? Okay, so that is firmly in place. And what I will do now in a moment is just run around it with an extra fine diamond. Now, ordinarily, of course, I'll be using water, but difficult in this scenario. And I absolutely love this profile of burr with the slight taper going into the tip. If you use the absolute flat profile ones, I find they gouge and dig very, very easily indeed. So I'm just going to go over now to a cup just to finish it. You can use discs, you can use whatever you like. It is composite, use what you prefer. What you will see is the interface between the occlusal form, which is along that line, and the wedge of composite. I have yet to see any stain line where the composite joins the occlusal form. It's just a lovely material because the glass in the occlusal form is exactly the same glass as used in the composite filler, and they are designed to work properly together. Now, what you can see on here is that this anatomy is that of a brand new tooth. Of course, if you've got an aged tooth, you're not going to want that form. You're going to want it much, much flatter. So if I just take it down now and show you on the platal cusps, just for comparison. I would do this high speed with water normally, but nothing wrong with doing it slow. Certainly as a patient, I prefer high speed with water. I mean, certainly there's enough thickness of the form there that you're not going to perforate through. I mean, this is quite a crude process anyway at this stage for a demonstration, but in the mouth you know precisely what you want. You can match up the occlusion. And I could go on and on. But hopefully that does show quite well. And of course, the deeper you go, if you're using a darker composite, the more the dark colour is going to shine through the thinning occlusal form. So you can even get to the point where you would have dark dentine shining through the enamel. I wouldn't say maybe go as far as replicating cup cavities, but the world is your oyster on that one. It's very much how much you want to personalise it. And there you are. That's an occlusal form as well, which I've done a little bit of personalisation on that palatal cusp, but it just shows the adjustability of it. You can see the brand new tooth enamel morphology there. You can see I've taken down that cusp. You start and stop exactly where you want to start and stop, completely customizable. Doesn't have to go back to anybody to be polished, but once you have polished it, unlike a composite veneer, remember this is a glass veneer, once it's polished, it will stay polished. It won't deaden. It won't change colour with time either, because again, there's no organic component in the material.